The Down syndrome is the most common chromosomal disorder occurring with a frequency of 1:800 to 1:1000 newborns. The chromosome number 21 is present in triplicate, usually because of meiotic non-disjunction in either maternal or paternal gamete, and in most cases the extra chromosome is from mother. And the Down syndrome occurs most often in offspring of mothers conceiving at older age. The risk in newborn is 1 is to 1550 if maternal age is 15 to 29 years, 1 is to 800 at 30 to 34 years, 1 is to 270 at 35 to 39 years, and 1 is to 100 at 40 to 45 years, and 1 is to 50 after 45 years. So the risk of Down syndrome increases with maternal age. And the cytogenetics, trisomy 21 is found in 95% of the cases. Approximately 1% of the cases are mosaic, and the rest 4% are due to translocation, most commonly involving chromosome number 21 and 14. The karyotype of the parent is only required if the affected child has translocation causing Down syndrome. And talking about clinical feature and diagnosis, the patient with Down syndrome have intellectual disability and physical retardation, the flat facial profile, and upward slant of eye and epicanthic fold. The oblique palpebral fissure is obvious only when the eyes are open. The nose is small with flat nasal bridge. Mouth shows a narrow, short palate with small teeth and forward protruding tongue. There is significant hypotonia. The skull appears small and brachycephalic with mild occiput. The ears are small and dysplastic. There is characteristic facial grimace on crying, and the hands are short and broad. We can see the clinodactyly, that is a hypoplasia of middle phalanx of fifth finger and the Simeon crease. And there is wide gap between the first and second two, that is also known as sandal gap. And the associated congenital anomalies include the congenital heart disease. Approximately 40% of the children have the congenital heart disease. The endocardial cushion defect accounts for 40 to 60% of the cases. The presence of heart disease is the chief factor in determining the survival, and all children should have a cardiac evaluation before 9 months of age, including echocardiography. The gastrointestinal malformation like atresia are present in 12% of the cases, especially duodenal atresia. There is increased risk of annular pancreas and the Hirschsprung disease. There can be ophthalmic problems like there is an increased risk of cataract, nystagmus, squint, and abnormalities of visual acuity. And the routine evaluation is performed in infancy and then yearly. The hearing defect like 42 to 60% have the conductive hearing loss and prone to serious otitis media, commonly during the first year. The routine evaluation is done before 6 months of age and then every year. The thyroid dysfunction, about 13 to 54% of the patients with Down syndrome have hypothyroidism. Thyroid function test, TIFO and TSH are recommended once in neonatal period or at first contact, every 6 months in infancy, and then every year. And this should ideally include anti-thyroid antibodies, especially in the older children, as etiology is usually autoimmune. And the atlanto-occipital subluxation is there in 13 to 30% cases. The lateral neck radiograph is recommended once in 3 to 5 years before surgery for participation in special games, or either if signs and symptoms suggest cord compression. And the physical growth, the regular follow-up for height and weight is necessary. The linear growth is retarded as compared to the normal, and the children tend to become obese with age. The muscle tone tends to improve with age, while progress with development slows with age. And the malignancy, the patient with the Down syndrome are increased risk of development of lymphoproliferative disorder, including acute lymphoblastic leukemia, acute myeloid leukemia, myelodysplasia, and the transient lymphoproliferative syndrome. For the management and prognosis, the principle of management are early stimulation, physiotherapy, and speech therapy. Associated problem need to be treated as required. The social performance is usually achieved beyond that expected for mental age. Generally, they are happy children, like they like mimic. They do mimicry. They are friendly. They have good sense of rhythm, and they enjoy music. And the chief cause of early mortality in congenital heart disease is almost 50%. With cardiac anomalies die in infancy. Chronic rhinitis, conjunctivitis, periodontal disease are common. The lower respiratory tract infection poses threat to life. The hematological malignancy are other cause of mortality. And the counseling, the patient of the child with Down syndrome should be counseled with the tact, compassion, and truthfulness. Briefly, one should inform about the disorder as early as possible after diagnosis is confirmed. And the counsel in the presence of both parents in privacy, talk in simple positive language, giving hope and allow sufficient time to parent to ask question, discussing non-problem and associated disorder, highlight the importance of early stimulation, and asking the patient to contact the local Down syndrome association if it exists, and informing them about recurrence risk and possibility of prenatal diagnosis. And the prenatal screening and diagnosis is done for the parents who wish to get a prenatal diagnosis, and they can directly get fetal karyotype either by CV chorionic villus sampling or by amniocentesis. So thank you. That was all about Down syndrome.